Inflammatory bowel disease (IBD) is a broad term that includes chronic remittent inflammatory conditions of the gastrointestinal tract. In fact, both acute and chronic gastroenteritis can cause bowel inflammation. Diagnosis of IBD is IBD, I for isolated. No single test can confirm colitis or Crohn's diagnosis. B. Basket. The diagnosis is based on a basket combination of clinical, laboratory tests, endoscopic and biopsy histological and imaging findings. D. Other diseases to be excluded. Infections can present similar to IBD with abdominal pain, diarrhea, and endoscopic histologic finding. For example, tuberculosis, other parasitic, fungal, bacterial ones can be infectious mimics. Non-infectious mimics like autoimmune diseases, vasculitis, intestinal ischemia, drug-induced colitis. For diagnosis, in other diseases, for example, acute cholangitis, in the past, we based on clinical fever, epigastric pain, and jaundice. In hepatitis B, blood test is used for diagnosis by demonstrating positive HbSAg. In peptic ulcer, we use endoscopy to diagnose by seeing an ulcer inside the stomach. In colon cancer, a biopsy with histology is needed to confirm a diagnosis, while in gallstone disease, radiological finding is enough in the diagnosis. Coming back to inflammatory bowel disease, the diagnosis of IBD is based on a combination of clinical, laboratory tests, endoscopic, biopsy, histological, and imaging findings. Clinical information are needed in demonstrating chronic remittent disease cause and to exclude autoimmune and drug by history. In the laboratory tests, to show inflammation and exclude infection. In endoscopy, we can see the bowel inflammation by vision and to exclude malignancy. With the help of biopsy, histological examination, chronic inflammation of bowel can be demonstrated and also its infection can be excluded. Last but not least, radiological imaging can help in showing bowel extent and to exclude bowel ischemia. Therefore, the diagnosis of IBD is based on a combination of findings. The inflammatory bowel disease is usually further divided into two subsets, the ulcerative colitis (UC) and Crohn's disease (CD). But why is that so? It is because there are differences in symptoms, disease cause, and treatments between the UC and CD. Ulcerative colitis is diagnosed by demonstrating characteristic features of symmetrical, continuous, circumferential, mucosal inflammation, while Crohn's disease is diagnosed by demonstrating asymmetrical, focal, skip lesions, transmural, or non-caseating granulomatous inflammation. UC can affect any part of the large intestine, while CD can affect any part of GI tract from the mouth to the anus. Sir Samuel Wilkes, in a case report written in 1859, was the first physician who used the term ulcerative colitis to describe a condition similar to what is understood as UC today. Crohn's disease was recognized as an entity separate from UC in 1932 with a publication by Crohn's BB. In 5 to 15% of IBD patients, endoscopic and histological assessments cannot distinguish between Crohn's and UC, and these patients are labeled as IBD unclassified, or if features are still undeterminate after colectomy, histology is assessed, described as intermittent colitis.